Hello, and welcome to the first advocacy call of the 2020 legislative session. I'm excited to have everybody join us today and to be able to share some updates about what to expect during this session. My name is Tanya Dorf-Bruner, and I'm the Executive Director at Oral Health Kansas, and I'll be sharing a few updates and some previews with you today. The first thing I want to do is just review quickly our policy priorities for Oral Health Kansas. We generally think of our priorities as the three things we need to do to ensure that all Kansans have access to good oral health. And we think of that as kind of a three-legged stool. We first know that people have to have access to providers. So we have a set of policy priorities that relate to making sure that all Kansans have access to comprehensive oral health care and are able to access that as they need. The second is to ensure that all Kansans have access to a way to pay for their dental services. So we want to increase their financial capacity. That involves a number of policy areas related to CanCare and Medicaid, other insurance issues, and helping decision makers understand the importance of investing in oral health. And then the final one is improving the public oral health. And we sometimes call this willingness to access or understanding how to access. And this is a series of public health priorities, including community water fluoridation and a number of other public health strategies. So this year, we're very excited to say that we're going to be able to introduce a new bill called the Kansas Oral Health Improvement Act. This will be the first bill Oral Health Kansas has introduced in quite some time. It's designed to accomplish three major objectives, but then also make a few minor fixes in the Dental Practice Act. And those minor fixes are some language updates and a couple of just minor things. These are kind of standard things that happen in bills like this. But the three objectives we hope to accomplish are to permanently establish a state oral health plan, a process to develop a state oral health plan, and then do that at regular intervals. A state oral health plan is really a strategic plan that helps guide the public oral health programs and services in the state. Plan development is a stakeholder-driven process, and it really prepares the state and all the stakeholders as a group to understand the current and the future oral health needs and opportunities, as well as to prioritize solutions in an ongoing effort to reduce oral health disease burden in the state. This is a plan that Kansas has had multiple times in our history, but it's not supported at the federal level anymore. So we really want to make sure that the state level does support the state making this a priority. The second objective is to provide an increase to the CanCare dental rates. You may recall that a big legislative accomplishment in 2019 was getting a Medicaid dental benefit or Medicaid dental rate increase. That was the first increase that had happened since 2001. So it was a process that was 18 years in the making. It was a major victory, but it unfortunately really didn't go far enough. And I think we were clear about that at the time, but the increase was about $3 million. That includes state funds and federal funds, and that was enough to increase about 39 services by about 6%, which is remarkable and has had the benefit of making sure that fewer dental providers make the decision to stop being dental providers and Medicaid. But we really know that in order to make sure that the CanCare program works well for all beneficiaries, we need to have a much more robust dental provider network. So the bill also will provide an increase to the dental rates at a level that we hope will incentivize dental providers to be able to become CanCare providers. The final piece of the bill will be to establish an adult dental benefit in CanCare. Right now, CanCare or Medicaid covers pretty much most dental services that kids need, but for adults, it covers only extractions. The Medicaid managed care organizations that run the Medicaid program now all offer a variety of oral health benefits in addition to that extraction benefit, but they vary from plan to plan. So the goal here is to make sure that we've got just a comprehensive set of benefits that all adults can count on, and that is consistent across all the Medicaid managed care organizations. So we are in the process this week of talking with legislators about getting this bill introduced and getting getting ready to start promoting it. So we really just ask you to stay tuned. We'll share details about the bill introduction as soon as they are available, and we think that will be in the next several days. There are a couple of other major oral health or major health issues that will be prominent at the Capitol this year, and those are Medicaid expansion and dental therapy. So we want to talk just a little bit about both of those things. First of all, Medicaid expansion. This is an issue that Oral Health Kansas has supported for a very long time. The legislature has been debating this issue, or not debating it, for the better part of 10 years. Um, and there's just a few reasons here on these slides about why we really do need Medicaid expansion. If it was expanded, about 150,000 more Kansans would be insured. They would have both health and dental benefits. And again, if we had a comprehensive dental benefit for adults and we had Medicaid expansion, there's 150,000 more adults that would have access to those dental services. Medicaid expansion, or experts predict it would create at least 3,500. That says 35,000, but 3,500 new jobs in the next 5 years. Another really important impact would be keeping our rural hospitals open. We know that about a third of the rural hospitals in Kansas are considered financially vulnerable. Medicaid expansion would be a game changer for them, and we know that we've actually lost 2 or 3 hospitals in the last few years, and we want to stop that. So what progress is being made? This is the top policy priority for Governor Laura Kelly. The bill, there was a bill last year that passed out of the House. The Senate did not consider it, and then over the summer and fall, Governor Kelly and the Senate Majority Leader, Senator Denning, did a lot of negotiations and came up with a compromise bill. And it's called SB 252. This bill, I'll talk about here in more detail in a second, but the good thing is the bill has 22 co-sponsors in the Senate. In the Senate, it only takes 21 senators to pass the bill. So if the House remains on board and 22 senators remain interested, the possibility of passing it is a lot higher than it's been in pretty much any recent year. The other good thing is this bill is already scheduled for a hearing next week in the Senate Public Health and Welfare Committee. On next Thursday and Friday, the 23rd and 24th, the committee will be hearing testimony on the bill, and Oral Health Kansas is submitting testimony. It's just important to note, too, the Alliance for a Healthy Kansas is the coalition that is leading the charge and is organizing a lot of the advocacy around this bill. So just a little bit more about the bill, because the compromise nature of it is really so critical here. This is, as I said, a bipartisan proposal. This is a set of talking points that the governor released just last week when this plan was announced. And I want to note a few things here that are important and new. First of all, there's no barriers, no delays. That means the Medicaid program would be expanded to every individual in Kansas who has an income of up to 138% of the federal poverty level. Currently, adults on Medicaid are covered only if they're at about 30 or so percent of poverty level. So this will encompass an awful lot more adults, which will be wonderful. The 90-10 match issue means that the federal government would pay 90% of the cost of all the services for this population, and the state would cover 10%. And it will go into effect on January 1st, 2021. No delays means that it would be kind of a clean approach to expansion, and the federal government would not have to do any extra consideration. It would just immediately approve this plan. One of the issues that's been debated about Medicaid expansion for some time in Kansas has been whether there would be a work requirement. You can see this promoting personal responsibility bullet notes that while there will not be a work requirement, there will be a work referral program that will help Medicaid beneficiaries get connected to work programs if they're not already working. And it is important to note that, excuse me, most of the people in this population are working, but they're working maybe 2 or 3 jobs. They're minimum wage jobs. They're the kind of jobs that don't offer health insurance. So taking that work requirement away helps because it'll create less of a barrier, but also having a work referral program will help folks who are not yet working find a way to do that. And then the last thing, excuse me, the last thing I want to just cover here is about cost sharing measures. Excuse me, I'm sorry about that. The people in this expansion population will pay a monthly premium. And that's what the cost sharing means. They'll pay individuals will pay a premium of about $25 a month, or about $100 for a family of four. This is similar to what had passed in the past. One really good improvement, though, is the lack of lockouts. So lockouts were a part of the previous bill that was considered, and this that's taken away. What lockouts would mean is if for some reason I wasn't able to pay my premium next month, I'd be locked out of coverage for the next year. So this takes that away, and if I have trouble paying my premium next month, I don't get kicked off of the program. So it's a meaningful compromise. This is the best and most forward progress we've had in a number of years on Medicaid expansion. And please do stay tuned, and please follow the Alliance for Healthy Kansas for updates about the bill as well. The other thing we wanted to talk about in terms of policy is the dental therapist legislation. This is another piece of legislation that's been considered for probably the better part of a decade as well in the legislature. And just a few notes here about what dental therapists are. They would be kind of a mid-level professional. They would work under the supervision of a dentist to provide routine and preventive care. They would be dental hygienists who would do the normal scope of practice, like cleanings and all sorts of preventive services. They also would be able to do some fillings and some very simple extractions. They would be able to work in dental offices and in community-based settings, such as nursing homes and schools. They would be trained through programs accredited by the Commission on Dental Accreditation, and there are other programs like that around the country right now. The argument in favor of having a dental therapist model is that there is a kind of a gap in dental workforce. There are several counties that don't have enough dental providers, and dental therapists would then allow dentists to possibly be able to treat more people because they could add some capacity to their offices. Certainly would be add capacity in community health centers as well. So the progress on this, as I said, this issue has been debated for a better part of about 10 years. In 2018, there was a bill, Senate Bill 312, made it through the Senate and passed unanimously, but then was killed in the House. Political issues kind of trumped most things, and so it was killed in the House. The Kansas Dental Hygienists Association is taking the lead on this bill, and they are planning a legislative day in early February. So we'll keep you posted about that and keep you posted about this bill's progress as it makes its way through the legislature again this year. Just to note a few hearings of interest coming up for next week. As I said, the Senate Bill 252, which is the Medicaid expansion bill, will be heard in the Senate Public Health and Welfare Committee on Thursday and Friday. But Monday and Tuesday, there'll just be kind of a state of the health of Kansas in the Senate on Tuesday, and then in the House on Wednesday. We primarily pay a lot of attention to the health committees, and so this is really what we're seeing them covering next week. The thing we wanted to really share with you this week and show you how to do if you're not already familiar is how to pay attention to, how to participate in hearings if you can't be at the Capitol in Topeka. So the good thing is you now can participate by listening into to every hearing in the Capitol. What you do is you visit www.kslegislature.org. That's the legislature's website. And I have a little image here that shows you, if you get to the upper right-hand corner of the screen, if you hover over the tab that says audio video, then scroll down and select State House Live and Archive, and you can see what that looks like there. Once you hit State House Live and Archive, a calendar for the week pops up, or a calendar for the day pops up. And you can see what the hearings were for today. The legislature was basically closed, so there wasn't any hearings today. But you'll see a calendar. You just literally click on the hearing that you want to listen to, and some of the hearings are video, but most of them are just audio. But you can at least participate and listen to anything happening in the Capitol. We encourage you to do that. I would just stop here and see if anybody has any questions before we wrap up for today. Don't think I see any. Let's see. Nope, I don't think I see any questions. Well, I really appreciate the participation today, and wish you a happy snow day. Hope everybody is safe and warm today, and look forward to talking with you again in a couple of weeks for the next biweekly call. If you have any questions or concerns or ideas in the meantime, please don't hesitate to get a hold of us. And please do follow us on Facebook and Twitter. We post updates about policy things there as well as email updates. So please follow us, and we'll see you again in a couple weeks. Thank you.